When you cross the age of 60, your body's chemistry undergoes a profound shift. The medications that once helped you can suddenly become your greatest risk. In this investigative look, we uncover why standard prescriptions are leading to thousands of emergency room visits every year for the elderly. As we age, our kidneys and liver process chemicals differently. This isn't just about side effects, it's about survival. Today we look at NSAIDs. The way your system metabolizes drugs slows down, meaning toxins can linger in your bloodstream far longer than they used to, especially common painkillers. NSAIDs like ibuprofen or naproxen are in most cabinets, but for those over 60, they can trigger silent internal bleeding and sudden kidney failure. Protecting your longevity starts with knowledge. Take care of yourself, because your health is truly your greatest wealth. For millions of seniors, a good night's sleep is a constant struggle. But the pills designed to provide rest are often a gateway to a much more dangerous reality. Benzodiazepines and common over-the-counter sedatives are behind a staggering percentage of senior falls and cognitive impairments every year. Z-drugs and antihistamines don't just put you to sleep, they linger in your system, clouding your mind long after you wake up, leading to a loss of independence. In the over 60 population, these drugs can mimic the symptoms of dementia, leading to misdiagnoses and a dangerous decline in cognitive function. Because your liver processes these sedatives more slowly, your balance is compromised, making a midnight trip to the kitchen a high-stakes risk for a hip fracture. Take care of yourself, because your health is truly your greatest wealth. For those over 60, managing blood pressure is a daily ritual, but the very pills that keep your numbers in check can sometimes lead to a sudden, life-altering collapse. Certain diuretics and alpha blockers can cause a rapid drop in blood pressure when you stand up, a condition known as orthostatic hypotension. As we age, our blood vessels lose flexibility. These medications can overcorrect, leaving the brain momentarily starved of oxygenated blood. The result isn't just a dizzy spell, it's a sudden blackout that leads to catastrophic falls, head injuries, and broken hips in the middle of the night. Never stop your medication, but consult your physician about dosage timing. Often, a simple adjustment can prevent a devastating accident. Take care of yourself, because your health is truly your greatest wealth. For seniors managing type 2 diabetes, the goal is control. However, data shows that overtreatment is now a leading cause of emergency hospitalizations for those over 60. Clinical studies indicate that severe hypoglycemia is responsible for approximately 100,000 emergency room visits annually in the geriatric population. Sulfonylureas and insulin can drive blood sugar to dangerously low levels, causing neuroglycopenia, a state where the brain lacks the glucose necessary for basic cognitive function. As kidney function declines with age, these drugs remain in the system longer, significantly increasing the half-life and the duration of the hypoglycemic risk. The result is sudden disorientation, or a total loss of consciousness. For a senior, this often manifests as a fall that results in severe trauma or permanent disability. Take care of yourself, because your health is truly your greatest wealth. Anticholinergics are among the most widely used medications in the geriatric population. However, medical data reveals they block a critical neurotransmitter essential for memory and muscle control. Research published in major medical journals indicates that high anticholinergic use is associated with a 50% increased risk of developing dementia over time. For those over 60, these drugs can cross the blood-brain barrier rapidly, leading to acute confusion, blurred vision, and a sudden inability to navigate familiar surroundings. Because the aging brain has fewer cholinergic neurons, the impact of these drugs is amplified, creating a chemical imbalance that the body can no longer counteract. This imbalance increases the risk of urinary retention and physical instability, frequently leading to nocturnal falls that result in emergency surgical intervention. Take care of yourself, because your health is truly your greatest wealth. For adults over 60 with atrial fibrillation or heart conditions, blood thinners are a life-saving necessity. However, anticoagulants are now among the most common medications associated with major adverse drug events. Data from clinical registries shows that for patients over 75, the risk of a major bleeding event increases by approximately 5% annually compared to younger cohorts. Because aging skin and blood vessels are more fragile, a minor bump or bruise can mask a serious internal bleed, specifically intracranial hemorrhage, which carries high mortality rates. Interactions with vitamin K-rich foods or herbal supplements like ginkgo biloba can unpredictably alter the drug's efficacy, either increasing bleeding risk or leading to dangerous clots. Regular monitoring and strict adherence to dosage are critical. Data confirms that patient education reduces the incidence of severe bleeding by 30% in the first year of therapy. Take care of yourself, because your health is truly your greatest wealth. Muscle relaxants are frequently prescribed for acute musculoskeletal pain. However, clinical guidelines, including the Beers criteria, strongly recommend against their use in adults over 60. Data indicates that these compounds have a high anticholinergic burden, leading to a twofold increase in the risk of hip fractures within the first week of use. Because the aging metabolism processes these sedatives slowly, the result is prolonged sedation, often manifesting as extreme daytime drowsiness and cognitive clouding. This level of sedation significantly impairs motor coordination and reaction time, turning routine physical movements into high-risk events for severe traumatic injury. Evidence suggests that non-pharmacological interventions or safer alternatives provide superior long-term outcomes without the catastrophic risk of a fall. Take care of yourself, because your health is truly your greatest wealth. Digoxin has been a cornerstone of heart failure treatment for decades. But for those over 60, the window between a therapeutic dose and a toxic one is dangerously narrow. Clinical data indicates that digoxin toxicity remains a significant cause of drug-related hospitalizations among the elderly, often due to accidental accumulation. As kidney function naturally declines with age, the body's ability to clear digoxin is impaired. What was once a life-saving dose can build up to lethal concentrations in the bloodstream. Toxicity often manifests silently, through confusion or a characteristic yellowish haze in the vision, which many seniors mistake for natural aging or simple fatigue. Strict monitoring of serum digoxin levels is essential. Data shows that regular testing can reduce the risk of life-threatening cardiac arrhythmias by over 40%. Take care of yourself, because your health is truly your greatest wealth. Antipsychotics are frequently used off-label to manage behavioral symptoms of dementia. However, clinical data reveals a dangerous trade-off between sedation and life-threatening complications. The FDA has issued a black box warning for all atypical antipsychotics, citing a significant increase in the risk of death compared to placebo in the geriatric population. Clinical studies show that patients over 65 using these medications face a threefold increase in the risk of ischemic stroke within the first few weeks of therapy. Beyond stroke, antipsychotics can trigger rapid weight gain and severe metabolic disturbances, which exacerbate existing cardiovascular conditions and double the risk of pneumonia. Data confirms that behavioral interventions often provide safer, more effective management of dementia symptoms without the lethal side effects of high-potency antipsychotics. Take care of yourself, because your health is truly your greatest wealth. Proton pump inhibitors are among the most commonly utilized medications for acid reflux. However, data indicates that chronic use in those over 60 creates a systemic disruption of nutrient absorption. Clinical studies show that long-term PPI therapy is associated with a 25% increased risk of hip and spine fractures due to impaired calcium absorption. Extended suppression of gastric acid prevents the release of vitamin B12 from food proteins, leading to progressive neurological deficits and chronic anemia in the elderly population. Furthermore, PPI use significantly increases susceptibility to Clostridioides difficile, a severe bacterial infection that can lead to life-threatening inflammation of the colon. Regular clinical review is essential to ensure PPIs are only used at the lowest effective dose for the shortest duration necessary to mitigate these multi-organ risks. Take care of yourself, because your health is truly your greatest wealth. Opioids are frequently prescribed to manage chronic pain. However, clinical data indicates that adults over 60 are significantly more susceptible to life-threatening side effects than younger populations. Studies show that age-related changes in pulmonary function increase the risk of opioid-induced respiratory depression, a condition where breathing becomes dangerously slow or shallow. Because opioids affect the central nervous system, they impair balance and cognitive clarity, leading to a threefold increase in the incidence of fractures and emergency trauma center admissions. Furthermore, opioids nearly always trigger severe constipation in seniors, which, if left unmanaged, can lead to bowel obstructions and systemic inflammatory responses. A multimodal approach to pain is essential. Data confirms that non-opioid alternatives can effectively manage pain while eliminating the catastrophic risks associated with narcotic use in later life. It is imperative that any pain management strategy in later life strictly limits exposure to these powerful narcotics. The data demands caution. Statins are the most widely prescribed class of medications for cardiovascular health. However, clinical data reveals that for adults over 60, the balance between benefit and risk requires careful scrutiny. Clinical studies indicate that up to 10% of senior patients experience statin-associated muscle symptoms, ranging from persistent soreness to rare, life-threatening rhabdomyolysis. Because aging muscles have reduced regenerative capacity, the biochemical impact of certain statins can lead to profound physical weakness, significantly increasing the statistical risk of fall-related injuries. Data also shows a small but significant percentage of seniors experience elevated liver enzymes, necessitating regular serum monitoring to prevent permanent hepatic dysfunction. A personalized approach to lipid management is essential. Factual evidence confirms that for many seniors, dosage adjustments or alternative therapies can maintain heart health while preserving physical and cognitive independence. The data demands a vigilant and evidence-based approach to medication in our later years. Knowledge remains the most effective tool for senior safety.